I'm so proud that this legislation is being heard today in the Insurance Committee and has such broad bipartisan support. It's absolutely critical that the state of Connecticut step up and protect women's health care. Women's health care is under attack at the federal level. The Trump administration and Republicans in Congress have unfortunately fought the entire time for the last year and a half to undo the progress that was made under the Affordable Health Care Act, to preserve access to health care for women, to ensure that women have coverage that they rely on. And we're here to stand up and say, in Connecticut, we're going to protect those benefits. We're going to make sure that the 10 essential health care benefits that were a key part of the Affordable Care Act will stay in place here in Connecticut. We're also going to make sure that women continue to have access to the full spectrum of reproductive health care in the state of Connecticut, no matter what happens with decisions in Washington, D.C. And I'm so happy that these proposals are bipartisan proposals, that in Connecticut, we value women's health care in a different way. It doesn't follow along party lines, that women here work together and make sure that women in Connecticut will be protected despite the extreme actions of our federal government. These bills are going to ensure that women in Connecticut don't have to worry about having access to health care, that they will continue to be able to access free contraception, which is critical for so many women. Since contraception has been free under the Affordable Care Act, more and more women have access to that. We were preventing unwanted pregnancies and also making sure that women who need access to birth control for other health care issues can have that coverage. Birth control can be very expensive, especially if you're someone who's working and living paycheck to paycheck. Sometimes you have to cut costs. And if we go back to a time when women have to pay, hundreds of dollars a year to pay for access to contraception, we're going to be moving backwards. We're going to make sure that in Connecticut, we're only moving forward to protect women in the state of Connecticut.
These are the Bill of Rights when it comes to health care. You cannot get access to good health care and stay healthy without these 10 things. Number 1 is ambulatory services. 2 is emergency services. 3 is hospitalization. 4 is maternity services. 5 is mental health and substance abuse, which in the midst of the big opioid crisis is such a vital right that all insurance companies must carry under the Affordable Care Act. If it gets repealed, they will not have to. Think about that in the context of 1,000 people dying per year in the state of Connecticut. 6 is prescription drug coverage. 7 is rehabilitative services. 8 is lab services. 9 is preventative and wellness care, and 10 is pediatric services.
The essential health benefits are a crucial part of health care, particularly for women. With repeated attacks on the Affordable Care Act, the Connecticut State Legislature should make it a priority to ensure that women in Connecticut will never have to go without birth control or maternity care again.
We have to think about the effect that it will have on families across the state, simply from an economic standpoint. And we find ourselves asking questions like, should I pay rent or should I buy my medication? Should I pay my mortgage or should I go to the doctor today? And one thing that we find really scary, should I send my child to college or should I send her to rehab? These are all issues that people in the state of Connecticut are facing every day. And this legislation will ensure that we don't have to make those choices anymore. So as we sit here and talk about the fact that it's family issues, that it's women's issues, it's all of that. But it's also an economic issue. And a vote for this legislation would ultimately mean a vote for the economic safety of the people of Connecticut.
The provisions in this bill will truly help save lives. Access to things like disease screenings and cancer screenings and preventative screenings will help save lives in our state. And the second point is this bill will also help support women in the workforce. There's 900,000 women in the workforce in Connecticut, and over 400,000 of those women are in their reproductive years. And we want to make sure we're doing everything we can to support those women to stay in the workforce during their reproductive years. Many of these women, in fact, 13% of them are the primary breadwinners of their families, and supporting them with things like access to prenatal care and access to affordable contraception and other coverage will be critical to helping support women in the workforce so that they can continue to access affordable health care and provide for their children and their families.